Hello, this is Dr. David Green, CEO of the Ohio Pain Network. Today's topic is, what are the indications for spinal discectomy surgery for sciatica? Sciatica occurs in 1 to 2% of the population at any one point in time. Most people have no clue what they did as an inciting event. There wasn't like a huge trauma or sporting injury or whatnot. It's typically due to a slow disc degeneration that eventually results in a tear of the outer part of the disc with the inner part squeezing out. Symptoms can vary. They typically result in a pinched or irritated nerve root that gets inflamed. Okay, this can cause leg pain, sensation of burning or pins and needles sensation, possibly some numbness or weakness, and rarely incontinence. Initial treatments should consist of a short period of bed rest. The old adage of 7 days in bed has been shown to be more detrimental. Anything over 48 hours is bad. The person should start getting up and walking. Over-the-counter medications such as anti-inflammatories and Tylenol, physical therapy, chiropractic treatment, spinal decompression therapy has been shown to be very helpful. Prescription medications may include a Medrol dose pack, narcotic medications, muscle relaxers, neuropathic medications like Neurontin or Lyrica, and then there's interventional treatments such as trigger point injections or epidurals. So what are the indications for sciatica surgery? There's 3 types of indications. One is absolute, meaning you got to have it or else there's going to be significant consequences. Second is a relative indication where it should be considered, but it's not mandatory. And the third is quality of life, where a lot of conservative treatments have been tried and just hasn't worked. So for the absolute indication, this is called cauda equina syndrome. Okay, and you can see that in the diagram here. At the area that the spinal cord itself ends around T12 or L1. Okay, now it does continue to go on. It looks like the spinal cord, but basically what you're dealing with is a bunch of just filaments that are remaining. Okay, now if you have a large disc herniation that pinches severely on what's called the cauda equina, you can get cauda equina syndrome. Okay, and here you see it from a slice approach, looking top down. Large disc herniation, pinching. Okay, and that can cause irreversible incontinence to bowel and bladder, difficulty walking. So when those symptoms start, and this is seen on an MRI, it should be operated on within 24 hours. So looking at the relative indications for surgery, first and foremost is motor weakness. So let's say the nerve root that's getting pinched is L5, okay, and as a result of that you have a weakness in your foot and you're unable to lift it up properly. This could be a complete inability or simply just weakness, all right? Now, if a pain doctor sees that and correlates it with the MRI, it doesn't mean you have to have surgery tomorrow, okay? This can be watched for a little while. The question is, how long is too long to watch it? Because after a certain amount of time, if it's not getting better, it doesn't matter how good the surgery is and how much it gets decompressed on the nerve root, it may not get better, okay? We don't know the black and white answer to that. It may be 6 weeks, it may be 12 weeks, which is the appropriate time to watch it. But it can be watched for at least a few weeks to see if it's going to get better. Now, if it's continuing to get worse, meaning it's a little weakness, and then it's a severe weakness, and then a ton of weakness, that means it's getting worse, right? So that becomes a relative indication as well that, you know, the problem is getting more severe and not getting better. When you look at the elective type of reason for surgery, this is when you have over 6 weeks of consecutive conservative treatment and you basically tried all the things available. Medications, physical therapy, chiropractic, spinal decompression therapy, injections. If none of this is working, after 6 weeks, a patient can reasonably say, you know, this is killing me, I'm unable to work, I can't walk properly, and so on and so forth. I'm going to go ahead and have the surgery. Now, what are the outcomes? Well, less than 10% of people will end up needing surgery for sciatica. Over 90% get good to excellent results with the surgery, but there are some small risks associated with it, you know, which need to be looked at before undergoing. There was a landmark study back in 2006 looking at operative versus non-operative treatment for disc herniation, and they showed that at 1 year the outcomes are identical. Okay, so you don't have to have surgery unless it's within that absolute category or potentially in the relative category if the muscle weakness is getting worse. Surgery in that study did help increase mobility and decrease pain faster, but the results were no different at 1 year. The top non-operative pain management in Ohio is through the Ohio Pain Network. There are several clinics accepting over 50 insurances and providing over 25 different treatment options with the board-certified physicians. Visit us online today at ohiopainnetwork.com and then call us for more information and scheduling at 888-466-9898. I'm Dr. David Green with the Ohio Pain Network. Your pain stops here.